Time now for Clarion Connection with Ron Wilshire. It's because it is a Wednesday. It's Wednesday, you know what that means.
Clarion Connection.
Clarion Connection time. And we got a guest in here today that's pretty special today.
Yeah. It's my daughter, Hilarie Donnelly. She's living in London with her two children, two grandchildren. So it's been a special week and a half. And I thought we'd talk a little bit about living in London, making it Clarion Connection. Hilarie, how did you ever end up in London?
Well, Dad, I had the opportunity to go to London in 2010. Our church asked if we would possibly be able to go and help with a church that was starting in London. And so, since my husband's a British citizen, we were able to go and move there and still have a regular job, but kind of help with our church that was starting. So
What is your regular job?
My regular job is a music teacher.
And I thought a little bit later we'd talk about some of the education system in London and some observations and everything. A lot of people here are interested in healthcare. It's becoming a big election issue, and you hear so many rumors about nationalized healthcare in London. I thought maybe we could talk a little bit about that, what it is and what it isn't, because like everything, I'm sure the devil's in the details.
Yeah, definitely. Surprisingly, I found the healthcare to actually be really good. I don't know if it's because I live in London. I live in a large metropolitan city, and I also live in a nice area of London. So I've found that actually that all of our needs have been met, and it's quite easy to use as well. You just go into you call, make an appointment, go in, no insurance cards, nothing like that. There are referrals, those kind of things are similar, but generally speaking, I haven't had to wait in long lines. I haven't had to, some of the things you hear, like people waiting for operations, things like that. I haven't experienced any of that myself. I know of other people that may have, but generally I found it to be easy enough to use and comprehensive. So.
And you went through the whole process with having one of your children over there.
Yes, I did. Actually, my son was born in my house. Not by choice, but was a spontaneous delivery is what they called it. But the emergency services came right away, and then they had a midwife that came, and she just came right in, and the baby was born 5 minutes later. So, and then they took me to the hospital, and they took care of everything that needed to be taken care of, and I was out in the same day, actually. I didn't stay any longer than, normally here you would stay maybe, 2 days or something, but I was out.
So everything went okay. We had lived in group in our family with her. And healthcare in London, is everybody eligible for it then?
No, you have to be a British citizen, or I think you can be an EU citizen as well, part of the European Union. You have to have some sort of documentation that you are a British citizen or an EU citizen. Because my husband is a British citizen, I have a visa, so I'm eligible for healthcare under him. But you have to go in, you have to sign up, just like you would sign up for maybe an insurance thing here. You have to go in, you have to register, you have to sign up, you have to show proof of your identity in order to get the healthcare.
So once you sign up, the rumors about anyone can just go in there, people that are visiting and everything.
Well, they can go in, but if they're not a member of the EU or a British citizen, I believe that they end up getting a bill in the end. I'm not exactly sure how it works, but I know that it's not just kind of a free-for-all for everyone.
Right, because a lot of people, moving in, and they're not all eligible for the health care.
No.
So, this is all free, right?
Actually, it's not free. I actually pay tax in order to get the health service. everyone pays tax. It's called a national insurance. It's different from the income tax. You have the income tax that you pay, and then you have a national insurance tax. National insurance tax is like your employment tax, and it covers health care and those kind of social, I don't know what you say, needs that you have. But it's actually quite extensive of a tax. I was a little bit shocked when I saw my first paycheck, but it is definitely not free.
So whether it's some type of natural health care here or other places, someone's going to end up paying for it.
Yep, someone's going to pay for it.
So
Yeah.
free lunches. That's what they're doing, huh?
Yes, it's not free at all.
What about the marathons and things? Is that part of the insurance?
It is. If you are employed, you pay about £7 for every prescription. £7 would be about $12 US. This can be any medication. It can be medication that would be very expensive here or medication that would be very cheap. It's all one flat rate. So if you are employed, you'll pay £7 per prescription. But if you're unemployed, you don't have to pay anything for your prescription. So it kind of helps. If you're what they call it, job seekers, is when you're not employed and you're seeking a job, you don't have to pay anything for your prescription. Also, if you've had a baby, the year after you had the baby, you have all free prescriptions as well, and free dental care, which is nice for me. So.
I mean, that's commonly a joke, but they have dental care, free dental care.
They do, but it's not very good, as you can tell by most. Yeah, but no, it's not. It's not free. You do have to pay a small amount, and it's the dental care is not as I feel that it's not as high quality as the U.S.
So a lot of different options out there. What have you've found pretty good results from going to their health care, and they seem to really care about the kids too.
Yeah, they're really. That's one thing that I feel like the UK really gets right, is they really take care of the children, and even the prenatal care is very, it's not as, you don't see an obstetrician like an actual doctor. You see a midwife for most of your appointments. You don't see a doctor very often, but actually the midwives take care of every little detail that's happening, and they have a very specific schedule of appointments, and they really do a lot to care for the kids. And even after they're born, they're always sending you notices about when the next vaccination is due. They're always reminding you. They have something called child benefit, which is really helpful. The government provides a small amount of money for each child that you have, and it doesn't matter what you make. If you make a lot of money or you make a little bit of money, everyone gets it for each child. And then each additional child, you get a little bit extra as well. So it's really helpful. They really care for the needs of the kids.
But it's not a situation where sometimes they say that welfare mothers want to have a lot of babies so they get more aid? Or
well, no, it wouldn't be that. It would be a little bit more technical than that, because it's not, honestly, the child benefit is probably, for one child, is £80 a month, which would be around, $120 maybe a month. For one child, that's not really enough to, if you have an additional child, it's £40 a month. So it's not a large amount of money that they would just keep having children just for that. However, if they're unemployed, they can apply for other state benefits where it might encourage the having many children situation. I'm not sure.
Is there a lot of unemployment in London?
In
just what you've seen.
What I've seen, I think it's difficult to find a job. There is a lot of immigrants coming in, taking a lot of jobs. I think it's similar, though. I would say that it's somewhat similar to the U.S., but it's not like everyone's unemployed or anything like that.
It's extremely expensive to live in London.
It is extremely expensive to live in London.
It's kind of like if you lived in New York City, it would be.
I would say it's comparable to New York City as far as the space of the apartments, the cost of living. You get paid a nice salary if you have a salary job, but it's all because of how expensive it is to live there.
So one of these big cities, that's kind of surprising that your church would ask you to go on a mission to London. Usually you think of remote places like Nigeria or Uganda or something. Why London?
Well, it's interesting because London is such an international city, and there's people from all over the world. I mean, people from countries that I probably have never even heard of, honestly, and there's lots of students. And so if you go in a church situation, you go to a place like London, you can meet a lot of those people from different countries and then send them out to those different countries to send the people home to their different countries to help spread the word and whatnot. So I think that's more the thinking, because it's such a central, metropolitan city with all these different nationalities. It's a great place to meet people, to tell them about the church and everything, and then to send them back to their countries and to preach the word, I guess, there.
How's the reception been from the people there?
It's been really good, actually. We started with, I think there were 30 people, and now there are 70, and it's only been a year and a half. So 70 committed members. Mm-hmm. So it's not just like come and go, and then we have over 100 at services now. So it's really actually been really people, and it's people from all walks of life. We've got people from China, we've got people from India, just all over, Americans, British, everyone. So it's really nice.
So it's been a real education for you, too.
Yeah, absolutely. Yeah.
A lot of people know you from your high school years here, and probably a lot of stuff you'd like people to forget. But they do know you from your singing and everything. And I promised I wouldn't ask you to sing. Okay. To do that. But do you get a chance to sing in the church service?
I do. I sing every service. So yeah, I get lots of opportunities to sing. So it's good.
So good. And is Abby, your daughter, following in your footsteps?
I'm not sure. She likes to sing. I don't know. She enjoys singing. So.
I mean, 6-month-old seems to have a good voice.
Yeah. He likes to cry a bit. So.
Pretty good. In the second section of the show, we're going to talk a little bit about the education system, since you are a teacher in the system somewhat over there. We're going to talk about that. I'd like to thank everyone for listening to Clarion Connection. We'll take a commercial break right now.
Get money from helping everyone else and have it all about me. Hospital sponsoring an expert just for women on Thursday, April 26th, starting at 6 o'clock at the Clarion Connection. One-hour speakers will teach you everything from keeping a spark in your relationship to how these methods have permanent damage makes speakers able to use keys, gigs, and lots of other trades. The cost for this event is $7. Registration is required. Call Clarion Hospital at 226-1DOC. Don't miss this evening. All about me. Call 226-1DOC.
I'll have the grilled cheese, please.
Hot or cold?
Hot isn't grilled hot.
We're still looking to hire a cook for the summer season, so cold?
But your name is Hot Grilled Cheeseria.
Yeah, I can give you bread and cheese, and you can try grilling it on your exhaust manifold.
Don't be stuck without a chef or any other seasonal employee you need. Log on to ClarionVidangoHelpWanted.com.
And if you have heated seats, you can sit on it and have a panini.
Okay. Post as many jobs as you like in minutes and use as many words as you want for one low price. ClarionVidangoHelpWanted.com. Long name, amazing results. Ms. Munster, would you file these documents?
Oh, okay, after I take your temperature.
Why are you a receptionist?
Well, because I couldn't find a nursing job.
Then why didn't you go online and check out ClarionVidangoHelpWanted.com?
Okay, sir, take off your shirt and I'll take your blood pressure.
They have hundreds of local jobs, hospital, sales, IT. Oops, sorry. She's just about...
Ooh, your blood pressure just went sky high.
Boy.
Okay, I'm going to need a specimen. Take this.
Get out! ClarionVidangoHelpWanted.com. Long name, amazing results.
My husband has a gambling problem, which is why we have a money problem.
What is going to change?
He's lost a lot of the tables, and now we might lose our house because of it.
How can you fix this?
Whenever he wins, he just pops it back into the game.
I'm always thinking about getting money so I don't need a lot.
The bill collectors keep calling. I don't know what to do anymore. can't stop.
Learn the signs of a gambling problem and get help at paproblemgambling.com. That's paproblemgambling.com. Or call 1-877-565-2112. A message from the PA Department of Health.
Welcome back to Clarion Connection. I'm Ron Wilshire with my guest today, Hilarie Donnelly, and we're talking about her life in London. Hilarie, when you went to Clarion, you went to Clarion for 2 years, and then Ithaca College, you graduated from 2 years later in New York, and you're a music major, and you've taught in Connecticut and then Chicago, and now you're teaching in London. What's the education system like there?
Well, there's a lot, because I think, again, because of it being such a large city, there's a wealth of different education systems, I guess. There's, of course, the public system, which is they call state schools. So if you go to a state school, that means you go to basically what we would call a public school. And then there's a large network of private schools, independent schools. Then you have, along the lines of private, you have like boarding schools, just all kinds of different schooling opportunities.
And all the private ones you have to pay for, I imagine.
Yeah, you have to pay quite a bit. I mean, I think that there's different levels of payment for private schools, but the really good private schools tend to be much more expensive.
Are people guaranteed a certain level of education in London?
Well, they are. There's a governing body called Ofsted that basically governs all the schools and their progress. They have a system where they go and observe at different. They do like an observation at different schools every 3 years. Every school has an inspection where they do observations. They come into the school. They basically take over the school. They look at all their plans. They look at everything that they do, and then they rate them on a scale. It's like outstanding, good, satisfactory. And I think, lower would mean that they would fail. But basically every school in the country is subjected to the Ofsted examination. So everyone's supposed to be given the same opportunities. But of course, if you go to a private school, you do get much more extra opportunities.
The education system seems to start a bit earlier. And I noticed Abby, your 3.5-year-old, she had to start, preschool?
Yes, she started nursery school in this past September. When you turn 3, the government allows for every child. Every child is supposed to be given some sort of early education, and so either the government will pay for 12 hours a week for nursery for the kids, which is preschool, or you can go to a state nursery school, which is a public nursery school, and in Abby's case, she's lucky where we live. There's actually a full-time nursery or preschool, and so she goes to school from 9 to 3 every day, and it's free. And it's also gotten a really great rating on the Ofsted rating scale that I was just talking about.
She's doing a lot with numbers and even colors. And that seems to be a good thing.
Yeah, it's structured nursery. It's not just like playing all day. I mean, while it is playing per se with some educational background to it, they employ in nurseries in England. They have kind of a exploring type idea with teaching. So Abby can basically choose what she wants to do. They have different like centers set up. She can do outdoor, where they might have a counting game outside, or indoor where they might be doing some rhyming, or they might be doing painting, or she can go in the little music corner where they have little music playing, or dress up, or all kinds of. So they have lots of choices, and so she's being able to choose what she wants to do, and also she's getting educated while she does it, which is really interesting. It's a lot different than what I've seen, so it's interesting.
So active participation in that.
Yeah, absolutely.
Now, the educational system, the public education system, does that go all the way through what we call high school here?
It does. It goes to 16 years old, and you take something called a GCSE, which is basically a big exam. And if at 16, basically, if you want, you can leave school and try to get a job. But a lot of people, they take an exam and they choose subjects that they study through high school. They might choose history, music. They might choose different subjects, and then they get tested in those subjects. And based on those results, they can be admitted to what they call a college. Now here, college and university are kind of interchangeable, but in England, a college refers to education from 16 to 18 years old. And after 18, that's when you would apply for a university. But up to 18 years old, it's free. It's public.
But you're not guaranteed admittance into college.
No, you're not guaranteed it. It can actually be very competitive. And then after college, when you try to get into university, there's only a certain amount of slots open. And it's very competitive, and not everyone can go.
So the tests are really important throughout the school system.
Yep, the tests are incredibly important. They take a test in at age 11 as well, which is called the 11 plus, where they'll be placed, based on those results, they can apply to a number of different secondary schools. The secondary school is like high school, and then after high school, at 16, they take the test to get into college. So it is, they do testing at crucial ages.
Is there a lot of pressure on from parents then to extra study and that type of thing?
Well, if you're in the state school situation, there's not always as much pressure, but in private schools, there's an incredible amount of pressure on children. I mean, children in my school, they have to, they're taking their 11 pluses, their 11 plus exam to get into secondary school, and they're going on interviews. Like, they have to actually be interviewed by the high school, and it's really extensive, and they're even offering at my school, coaching on interviews. So it's very, very competitive.
Let's talk a little bit about where you work, what type of school it is. I understand it's a private, sort of a chain.
Yeah, sort of a chain. It's a part of a network of schools, and that's a typical thing that you'll see in London. Is you'll see like not a company, or in our case, it's a family that started one school, and then they started some other schools as well in the same area of Southwest London. So yes, ours is part of it's a private school. So the parents have to pay to go to the school, and they also have to get admission through an assessment. So that you can't just kind of show up and pay the money. You have to actually be assessed and go through an application procedure to get in.
So even though they're enrolled in a private school, when these 11 tests come, it's no guarantee that they can go on there? Or does your school only operate to a certain level?
Right. My school only operates till about 11, 12 years old. So after that, they have to go on to another school. And so that's why it gets really competitive, because private schools, it's a preparatory school. So it's preparing them to go to a really high-level secondary school. So at 11, they're doing all these interviews and things so that they can go to a really good private school, secondary school.
Do you know if there's anything like adult education? There's quite a market in the States for that, so people that may not have done so well in high school or grade school, whatever, can go back and get education.
Yeah, they do. They have, there's actually some night schools that you can go to, and that would be the college market, not the university. It would be kind of the colleges that I spoke to that's normally for 16 to 18-year-olds. They also offer adult education courses, and you can go back and take, the GCSE exams if you want to. But yeah, they do offer some night schooling and some different, for returning adults kind of education. I have rarely seen online education, though. I don't see very many. I know in the States there's a lot of online universities, but I haven't seen a lot of those here or in London.
So there are still options out there. Now, how did you get hired by this school? How do you go about finding a job in London?
Well,
teaching in a private school.
A lot of prayer, I think, honestly, because the job that I did get is a really amazing job, and it's kind of unexplainable how I could get the job, really, because it's really at a high level school, and we teach a lot of even people that would be considered that famous, their children go to the school. But I just found an advertisement on a website. There's a teaching website that has a lot of ads for private schools in London. And so I went to that website, I applied, and then I went over for an interview. So
the rest is history.
Yes.
The rest is history. So what are some of the memorable moments that you've had teaching in London?
Well, I think
Your last position was in Chicago, and you were teaching. some students that, let's face it, from the families that probably didn't have much, or it was a special situation, and then you're thrown into London where you're getting probably teaching some kids from families with some means.
Yeah, absolutely. In Chicago, I taught in an inner city school, and in London, I teach at a private school, which it is very expensive to go there. So there are a lot of very wealthy and affluent parents, and it has been some of the really neat memories have been doing things like we have musicals at our school, and every grade, every year group was what they call it, does a musical, and so it's quite extensive. They have lighting and a pit band and costumes and scenery, and in some cases they're only 5 years old. So it's really, I've never seen anything. I've never been in a school environment where you can basically have anything you want, and any opportunity that you want to give the kids. So it's really, it's amazing when you actually have. I know people say that, it's not all about money, but I mean, to a certain extent, you do need money to really take the kids, to do these big high level things. So that's been pretty amazing to see the depth and the level that they go to at the school that I'm teaching at.
Any difference in the kids, or are they enthused to learn?
Yep. Honestly, kids are kids, I guess. I mean, even if they're from wealthy backgrounds, because I've taught the whole gamut of children, like just from really, really poor to like millionaires children, and they're excited about learning. They're positive. There hasn't been a lot of I expected there to be a little bit more like snobbiness, but I haven't seen a lot of that. So it's been really they're excited. They're kids at the end of the day, which is they behave just like other kids. So yeah.
Well, I understand Abby passed her admittance for the school.
Yes, she did. So she gets to go to the school, and that's another thing about the job is that the school is very, they're very generous, and they're very helpful as far as allowing children to go to the school. So they've been very helpful.
So what's next for you in the future? Just teaching you more and. Have you had a chance to see much of the country?
Yeah, not really. It's been kind of like frantic, especially having a second child now. So, but we have. I would like to go up north and see a little bit of Scotland and see some of the country areas because I literally live in central London. So, I'd like to get around to see some more scenic areas.
Well, your husband is from Northern Ireland, so. I know you've visited there a little bit.
Yeah.
So there's some family to visit there. So there's always something going on there. It's sort of like living in New York, but not having gone to the Statue of Liberty.
Exactly. Like I haven't been to Westminster Abbey. I haven't been to the Tower of London. I've just driven by or gone by on a bus by most of these places. I haven't seen a lot of them.
Well, that's good. I know, your mom, when she was over there to help out, got to visit some of those places, so she enjoyed it.
She saw more than I did, probably.
Yeah, it was kind of a blow. Medics rushing into the apartment.
Yes.
So we survived that, okay?
Yeah, she did. Yeah.
So, well, any last thoughts on your time in Clarion Connection? And thank you for coming in today.
Yeah, definitely.
And so we coming out, right, Steve?
I don't think we have enough time to cover the really squeeze in, but I think we're okay.
There's not a whole lot to talk about.
She's done a good job of the Dharma accent.
Yeah, I guess.
Her daughter knows a different story.
Yeah, a little bit of a British accent. Yeah.
Well, thank you for joining us on Clarion Connection. I'm Ron Wilshire. Join us next week for Ron Wilshire, the new provost of Clarion University.